So let's say someone in this room, God forbid, has a heart attack. Would you know what to do? Luckily, ER doc Dr. Simpson Davis, is here to show us the basic life-saving skills that can mean the difference between life and death. Doc, good to see you. So,
good to see you.
A lot of people do have heart attacks this time of year.
Yes.
And
yes.
I think most people are terrified about performing CPR or using an AED. Almost half our audience had no idea what an AED even is, but it's hugely life-saving. Tell us.
Yes, it is. Yes, it is. 350,000 people will suffer cardiac arrest this year, and 90% will unfortunately lose their life. And we can save lives. We see that if you jump right in and perform CPR, you can have a 2 to 3 times increase in saving a person's life. So we should go demonstrate and show them.
Can I tell you, I have one of these in my office. In my office, I have an AED because they're not cheap. But for the price of, what most of us spend on a vacation, you can get one of these, and it really will save your life. And it's so simple. Please, it's so simple. Tell us.
So let's start with CPR. If you're in a restaurant, we're having a great dinner, you see someone collapse and they're unresponsive, the first thing you want to do is kneel to the person's side. You want to tap them to see if they're awake or if they're any sort of life response. You want to listen to see if they're breathing, and you want to see if their chest wall is rising. And you want to have someone go call 911. It's so important. Call 911 right away. And then you want to start CPR. You want to push hard and you want to push fast. And it's very simple to do. You have to take the heel of your hand, you put it in the middle of the chest, you take your other hand, you put it over top, and you just press away. And you push hard and you push fast.
Don't worry about breaking ribs.
And do not worry about breaking ribs.
This person does not care about broken ribs.
If you break a rib and they live, they will thank you.
That's right.
And you want 100 to 120 compressions per minute, and you want to make sure you have your AED. If the AED is available, the automatic external device. This here delivers a shock if a person is in an abnormal heart rhythm.
Forgive the term, but they have idiot-proofed it. I mean, truly, anybody can do this.
So I just turned it on so we can see.
Yep.
And you want to place the pacer pads here.
Look at the diagram. It shows you. One side of the chest, the other side, and you slap those on.
So we put it on the chest, and it's telling us.
You would pull off the sticker part and put it on.
The sticker part underneath the shirt. We all are clear. And you push the button.
Shock delivered.
And
Begin 5 cycles of CPR.
And it's as simple as that. And then obviously it asks to start CPR again. You go back to sort of doing your chest compressions.
It walks you through how to do it. There's a guy in my building who was fine. He was perfectly fine. He died. He died of a heart attack. They used an AED on him. He's alive and well, and just bought one of these for our building. Truly, look into it, okay?
Time is
save your
hard.
life.
Time is hard. It's very
Heimlich
important.
maneuver. Hi. Oh, wow. This is interesting.
This is a great dinner.
Hi. Welcome. This is Jacqueline and Andrew? Yes. Okay. So you're out, you're enjoying steak dinner, and then somebody starts choking.
Start choking happens, and keep in mind, I want to have you stand here if I may. If someone is choking, they're not going to make any sounds. Oftentimes we have someone coughing or gasping for air, but they're making audible sounds. That means that they're able to clear their own airway. The concern is when someone is choking and they're not making the sounds. That's a true choking incident. And they usually give you the universal sign, which is I'm choking. We have Andrew step up here. And so we're going to demonstrate the Heimlich maneuver. You want to take a closed fist, Andrew, bring it around your wife. And then you want to take your other hand and put it over your closed fist. And what you want to do is just push inward and upward. And there we have it. And there we have it. We saved her life.
Last but not least, we do want to tell you, if you have to use the EpiPen, we're short on time, Sherry, apologies, but what's the one thing we need to know about an EpiPen?
So the EpiPen is pretty simple. You just take the cap off, you put it in the meaty part of the body, the shoulder or the arm, and you just inject it, and the medication goes in. It helps to open the airway. So if someone has an allergic reaction or asthma, it helps them to breathe, and it saves their life.
That is good to know. Look into this stuff, truly. This is, sadly, the season where it happens. Thank you all. Thank you all.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.